Well, as time has gone by, we're learning more about the virus and more about the syndrome that it causes when people become infected with it. We know now which receptors the virus needs to get into a cell, and we can tell where in a person's body they are more likely to express these receptors in higher numbers. And that has somewhat allowed us to predict the type of symptoms people will have, and sure enough, we've seen through experience they are having these additional symptoms. Now, the classic ones you'll hear about are fevers and any kind of respiratory symptoms, like shortness of breath or cough or anything that involves the lungs. But we also know that people are likely to express these receptors in the mouth and the throat and in the GI tract. So we have seen people get sore throat, some kinds of GI upset, diarrhea sometimes. We also know these receptors are expressed on the heart. And sometimes people get inflammation of the heart tissue itself and some chest pains. So we've even had some people present with what they thought was a heart attack, and in fact it was inflammation of some of the heart tissue that caused by the virus itself. We also know that people can have some effect in the nerves around the face that can cause an alteration in smell or an alteration in taste. And some people have noticed some skin changes, although that has been a little less specific. The vast majority of people will still have fever and some sort of respiratory symptom, and frequently achiness like you have any kind of viral syndrome. But over time we are seeing some of these additional symptoms. The other one that has been far less often but could be predicted from, again, where we see this receptor being expressed is inflammation of the testes or orchitis, and we have seen some symptoms of that over time as well.